है, बट वो गूगली पे गूगली डाले जा रहा है।
तो आरबीआई के बैंकिंग लोकपाल को इन्फॉर्म करो।
रुक, मैं समझाता हूँ। जैसे क्रिकेट में थर्ड अंपायर, वैसे ही आरबीआई का बैंकिंग ओम्बड्समैन। आरबीआई कहता है अगर बैंक आपकी कंप्लेंट को 1 महीने में नहीं सुलझाता तो आरबीआई के बैंकिंग ओम्बड्समैन में कंप्लेंट करो। यह आरबीआई का आसान तरीका है आपकी कंप्लेंट सुलझाने का, और वो भी फ्री।
समझे?
आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
अपना पिन, ओटीपी, सीवीवी या इंटरनेट बैंकिंग पासवर्ड किसी को ना दे। ऑनलाइन बैंकिंग सिर्फ अपने ही कंप्यूटर, मोबाइल और सिक्योर नेटवर्क से करें। हाँ, ये खाने की चैंपियनशिप थी क्या? आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
महात्मा के मंत्र। खुद वो बदलाव बनिए जो आप दुनिया में देखना चाहते हैं। महात्मा के मंत्र। स्वच्छता में ईश्वर का वास होता है।
और इस गीत के बाद
बहुत रोमांटिक दिवस के साथ साथ it has undergone 9 revisions. Coley with 903 rating points is 34 points behind Smith 900.
Hello and welcome to this special broadcast on DD India, #tracking COVID-19, your one-stop destination for all that you need to know on COVID-19, the top national and international updates and ground reports filed by our correspondents from different parts of the country. I'm Munmin Bhattacharya. Let's get started with the headlines. Prime Minister Narendra Modi asserts we need to move away from darkness and uncertainties of coronavirus. Urges all to light a candle, lamp or torch after turning off the lights at 9 p.m. on the 5th of April for 9 minutes. Appeals to all to not cross boundaries of social distancing. Active coronavirus cases in India increases to 2,088 with 56 deaths and 156 recoveries. Health Minister inspects readiness at Ram Manohar Lohia Hospital in Delhi, expresses confidence that India will surely win this fight against coronavirus. Health Ministry urges people to use the Arogya Setu app, calls it an effective tool for tracking corona patients. 415 new mandis being added to ENAM platform to effectively promote social distancing. Number of novel coronavirus infections cross 1 million across the globe. Over 2 lakh people recover, while over 54,000 succumb to COVID-19. After Italy, death toll in Spain nears 11,000 mark. And our top focus is that Prime Minister Narendra Modi has stressed on the need to move away from darkness and uncertainties brought upon by the coronavirus pandemic in his address to the nation this morning. And to this end, the Prime Minister has requested citizens to switch off all the lights on the 5th of April at 9 p.m. for 9 minutes and just light a candle, a diya or a mobile's flashlight to come together in our fight against coronavirus.
जो इस कोरोना संकट से सबसे ज्यादा प्रभावित है, हमारे गरीब भाई बहन, उन्हें कोरोना संकट से पैदा हुई निराशा से आशा की तरफ ले जाना है। इस कोरोना संकट से जो अंधकार और अनिश्चितता पैदा हुई है, उसे समाप्त करके हमें उजाले और निश्चितता की तरफ बढ़ना है। इस अंधकारमय कोरोना संकट को पराजित करने के लिए हमें प्रकाश के तेज को चारों दिशाओं में फैलाना है। 5 अप्रैल को रविवार को रात 9 बजे घर की सभी लाइटें बंद करके घर के दरवाजे पर या बालकनी में खड़े रहकर 9 मिनट के लिए मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट जलाएं और उस समय यदि घर की सभी लाइटें बंद करेंगे, चारों तरफ जब हर व्यक्ति एक एक दिया जलाएगा, तब प्रकाश की उस महाशक्ति का एहसास होगा जिसमें एक ही मकसद से हम सब लड़ रहे हैं, ये उजागर होगा।
In his video message shared with the nation, the PM stressed upon community strength. He added that the entire nation is fighting as one. He said that this crisis has also displayed our collective national unity, and this makes us even stronger to fight and defeat this menace.
कुछ लोग ये भी सोच रहे होंगे कि इतनी बड़ी लड़ाई को वो अकेले कैसे लड़ पाएंगे। ये प्रश्न भी मन में आते होंगे कि कितने दिन ऐसे और काटने पड़ेंगे। साथियों, ये लॉकडाउन का समय जरूर है। हम अपने अपने घरों में जरूर है, लेकिन हम में से कोई अकेला नहीं है। 130 करोड़ देशवासियों की सामूहिक शक्ति हर व्यक्ति के साथ है, हर व्यक्ति का संबल है। समय समय पर देशवासियों की इस सामूहिक शक्ति की विराटता, इसकी भव्यता और इसकी दिव्यता की अनुभूति करना आवश्यक है।
Prime Minister Modi has appealed to citizens to avoid gathering anywhere during the conduct of this program. He added that people don't have to go out onto the streets or even in colonies, but do it from their respective doorsteps and balconies.
इस आयोजन के समय किसी को भी कहीं पर भी इकट्ठा नहीं होना है। रास्तों में, गलियों में या मोहल्लों में नहीं जाना है। अपने घर के दरवाजे, बालकनी से ही इसे करना है। सोशल डिस्टेंसिंग की लक्ष्मण रेखा को कभी भी लांघना नहीं है। सोशल डिस्टेंसिंग को किसी भी हालत में तोड़ना नहीं है। कोरोना की चेन तोड़ने का यही रामबाण इलाज है।
The Health Ministry has informed that the Agriculture Ministry is taking initiatives to ensure social distancing. For instance, more mandis are being linked to ENAM.
मिनिस्ट्री ऑफ एग्रीकल्चर ने एग्रीकल्चर मार्केटिंग कमेटी में सोशल डिस्टेंसिंग और सैनिटरी मेजर्स को मेंटेन करने के अपने प्रयासों के तहत जो उनका एक ऑनलाइन पोर्टल है ENAM, दैट इज ई नेशनल एग्रीकल्चर मार्केट, उसको लॉन्च किया है। इस पोर्टल के तहत 16 राज्यों और 2 यूनियन टेरिटरीज में जो 585 मंडियां हैं, उनके अलावा और अतिरिक्त 415 मंडियों को भी जोड़े जाने का कार्यक्रम किया जा रहा है। इसके तहत जो किसान मंडियों में जाने की बजाय वह फिजिकली बिना प्रेजेंट हुए अपनी हार्वेस्टेड प्रोड्यूस, अपनी फसल को बेच सकते हैं। मोबाइल बेस्ड टाइमली पेमेंट से डीकंजेशन को कम करने में और हार्वेस्टेड एग्रीकल्चर प्रोड्यूस के सीमलेस ट्रांसपोर्टेशन में भी इससे फैसिलिटेशन होगा।
Union Health Minister Dr. Harshvardhan today visited Delhi's Ram Manohar Lohia Hospital and supervised the hospital's arrangements to combat coronavirus. During his visit, the minister also showed his gratitude towards the efforts being made by doctors, nurses and health workers.
आप सबके ऊपर सारे देश को गर्व है और सारे देश की निगाहें आपके काम पर लगी हैं। डॉक्टरों ने, हमारे क्लिनिशियंस ने, हमारे नर्सेज ने, हमारे एपिडेमियोलॉजिस्ट ने, हमारे पब्लिक हेल्थ के एक्सपर्ट्स ने, हमारा जो हेल्थ मिनिस्ट्री में टेक्निकल एडवाइजरी ग्रुप है, ICMR ने, सबने मिलकर जिस प्रकार से पहले ही दिन से सलाह दी और सलाह देने के बाद जिस प्रकार से सब लोग मिलकर एक टीम के रूप में निरंतर काम कर रहे हैं, उसी का शायद ये परिणाम है कि जिस कोविड-19 की आंधी तूफान ने सारी दुनिया के अंदर एक प्रकार से तबाही मचा दी, उसको हम भारत के अंदर कंट्रोल करने की स्थिति में हैं।
And the health minister also said that India will surely win this fight against coronavirus and also praised those who are working against this deadly disease.
मुझे पूरा विश्वास है कि बहुत ही जल्दी भारत कोरोना के खिलाफ युद्ध में सफलता प्राप्त करेगा और सारा देश आपको, मैं समझता हूं कि जिंदगी भर याद रखेगा। आपका जो कंट्रीब्यूशन है, जो आपका सेक्रीफाइस है, उस पर देश को हमेशा गर्व रहेगा। इसमें मैं समझता हूं कि किसी को भी कोई संदेह नहीं है।
Addressing a press briefing, Delhi Chief Minister Arvind Kejriwal urged the people of Delhi to adhere to lockdown and social distancing norms. Listen in.
अभी घबराने की ज़रूरत नहीं है, लेकिन जो प्रधानमंत्री जी ने लॉकडाउन का ऐलान किया हुआ, इसको बहुत बखूबी से लागू करते रहना है। सोशल डिस्टेंसिंग और लॉकडाउन का पालन करना है पूरी तरह से।
So let's now understand in greater detail the kind of steps that India is taking sector-wise to fight COVID-19. Well, the Health Ministry has issued a training advisory for health professionals. Let's take a look at what really this advisory is meant for. States have been advised for training of health workers at the field level, and there are several sectors on which this training exercise is focusing. There's surveillance, there's clinical management, there's management of isolation facilities, and there's more. We'll tell you about that. For instance, there is training in quarantine, psychosocial care, logistics, supply chain management. So the training advisory focuses on all these aspects that the centre has issued to various states. AIIMS is imparting continuous training in ICU care and ventilator management, so that is an ongoing exercise. AIIMS has been doing that for weeks now. 30 lakh downloads of Arogya Setu app for tracing, tracking and risk assessment has already taken place. So if you have Android or iOS, you can download that app and you can know if there is an infected person around you. 415 mandis are being linked to eNAM online agri portal. This is in addition to the existing mandis that are already linked, and that number is 585. So 585 mandis are already linked to eNAM in 16 states and UTs. Besides that, 400 odd are now also being linked. So this is what the Agriculture Ministry is doing for social distancing. DRDO has developed a biosuit with seamless glue for medical and paramedical staff. So this should keep the medical and paramedical staff protected from being infected. Health Minister has appealed to patients and they're keen to cooperate with health workers after reports of assaults and non-cooperation and discrimination against health workers came to the fore. So that's the appeal by the Health Minister. PM has also made that appeal several times. 157 corona positive patients have been cured so far, so this is good news. There should also be focus on how people are being treated and cured. The MHA, that is the Home Ministry, has written to states for strict action against those assaulting health professionals. That's extremely important. Remember, doctors in AIIMS had also written to the Health Ministry sometime back asking for strict action against such offenders. Centre has urged states to prepare for quick disbursal of benefits under PM Garib Kalyan Yojana. So that has been the constant emphasis of the centre, that the states should implement PM Garib Kalyan Yojana at the earliest possible. 960 foreigners linked to Tablighi Jamaat Nizamuddin event have already been blacklisted. This was an announcement made by the Health Ministry in the press conference. The 960 such foreigners have been blacklisted. They violated visa norms as they came to India on tourist visas, and hence they could not participate in any religious congregation, which they did. Blacklisting process has been initiated against 360 foreigners who have returned from India. So those who already left India, against them the blacklisting process has been initiated. Those in India have been blacklisted already. Disaster Management Act and Foreigners Act being invoked against visa violators, so we can expect more action with regard to those foreigners who were in India and had violated visa norms. 2 helplines added to 7 helplines in the MHA control room, so there are 2 more helpline numbers. We'll tell you about that. 1930 is the all India toll-free number, and 1944 is the helpline number that is meant specifically for the northeastern region. Besides that, there are 7 more numbers, as we told you. People can directly call helpline numbers of states and UTs. So there are several helpline numbers. You may choose whichever helpline number you would like to phone for resolving your queries. 182 laboratories are providing diagnosis for COVID. These are those that have already been affiliated by the ICMR. There are 130 government labs and 52 private labs out of those 182 labs that are there in the country that have the stamp of ICMR. 8,000 samples, the highest till date, tested on Thursday. So yesterday was the day when the highest number of samples in India were tested for COVID-19. 8,000 was that number. Besides that, let's take a look at how many samples have been tested in India till date. That number is 66,000. So 66,000 samples have been tested by India till date. And India is also thinking of re-looking at its testing criteria. We'll tell you more about that. Guidelines for using rapid diagnostic tests may be released on Saturday. This is something that we've been expecting for some time now. Those guidelines may be released on Saturday. Primary purposes, how to deploy these tests in high-risk areas, low-risk areas, hotspots, etc. So with focus being on these areas, that technique could soon be out in terms of guidelines. Sampling criteria may be revised if needed. So currently we know that there is testing that is taking place following a particular criteria. Not everyone can be tested. You have to fit in that particular criteria to be able to go in really for testing. Well, so that's about how India is fighting COVID-19, and due to the sudden rise in the number of COVID-19 positive cases in Rajasthan, the lockdown is being strictly adhered to in the state, but essential services are not affected by the lockdown. Here's a ground report by correspondent Vishal Baristo from Jaipur.
The sudden spike in the number of positive figures is definitely a big concern for Rajasthan. The positive numbers have already crossed 160 mark. But the good news is, out of 26 in Bhilwara, 17 have turned negative. The government is trying very hard, but at the same time, me and you, whatever religion we follow, we need to stay inside and follow the rules of the lockdown. If you have to pray, pray inside your house, pray for yourself, pray for the entire country. And also, the essential commodities are being taken care of by the authorities. So sit back, relax, and follow what the government has to say. With camera person Deepika, this is Vishal Baristo for DD India.
And there are similar scenes in Kolkata too, because lockdown continues in the city of Kolkata as well. The busy Red Road in Kolkata wears a deserted look. Our correspondent Anivrata takes stock of the situation from Bara Bazar area of Kolkata.
Kolkata's Bara Bazar, among one of the largest wholesale market in Asia. Right at this point of time, we witness that Bara Bazar is simply observing the 21 days lockdown that the Prime Minister Narendra Modi had given call to the people of the country to observe. And the business community here in Bara Bazar didn't unroll the shutters of their shops and establishments since Prime Minister has given the call of 21 days lockdown. It's truly amazing. And the road, that is MG Road, that is passes through Bara Bazar, here we find that the police is keeping an intensive look over the vehicles that are moving down this road, 1 or 2 in number. They are inquiring where they are going, whether they have true justification to go or not, that they are inquiring. So they want to keep enforce of the total lockdown that is there. One thing, another, is quite amazing is the fact is that they had the business community in Bara Bazar is truly responding to the Prime Minister's call, and they have come generously to contribute to the Prime Minister's fund that is care is being specially made up to take care of this corona menace. With cameraman Saurabh Dey and Basudev Mondol, I am Anibrata Bhattacharya reporting for DD India from Kolkata.
And the Maharashtra government has identified 30 hospitals across the state that will treat only coronavirus patients. There would be then around 2,305 beds across these hospitals for coronavirus patients. Our correspondent Shishir Shalar files this report from Mumbai.
This is the market. I'll show you, especially in the afternoon, the entire market. It seems like completely shut off here. Well, in a normal time, we cannot walk on this market, but in now, we have seen the situation here that the market is completely empty here. This kind of situation you can see everywhere in Maharashtra. But in spite of that, there are some places that people are not following the norms of social distancing, and that's the reason government is taking tough action against it. And the government have also given a clear warning that those who will not follow those social distancing norms will be obviously be punishable under the act that government is implementing. That's the reason, even though the government is appealing, government also appealing people that maintain the social distancing and stay at home and stay safe. For DD India, Shishir, Mumbai.
So those were our ground reports, and in Media Scan, let's now take a look at what the world media has to say on COVID-19. Let's take a look at what the international dailies are carrying in terms of reportage on COVID-19 and also analysis related to it. Let's begin with the New York Times. On the homepage, you see this headline: half the world is under stay-home order and White House debates face masks. It gives further information and says that New York Governor Cuomo has said that New York could run out of supplies in days. What are the essential supplies that it is talking about? Well, it says that Governor Andrew Cuomo has warned that time was running out to find critical supplies, including the ventilators needed for the sickest patients. And that is why President Trump has said that he was invoking the Defense Production Act to help shore up supplies of masks. So that's about the New York Times. Let's take a look at the Washington Post. And there's an interesting story here that says that experts and Trump's advisors now doubt White House's prediction of virus deaths. Leading disease forecasters whose research the White House used to conclude that there would be around 1 lakh to 2,40,000 people who will die as a result of coronavirus were mystified themselves when they saw the administration's projection this week. You read further and it says that White House officials have refused to explain how they generated the figure. A death toll bigger than the U.S. Suffered in the Vietnam War or even in 9/11. They have not provided the underlying data. So others can assess its reliability or provided long-term strategies to lower that death count. So there is a question mark as far as that death toll projection is concerned. Let's take a look at the Wall Street Journal. And here you see there's a report on the front page that says that U.S. employers cut 7,01,000 jobs in March. So it says that the March jobs report shows the start of a collapse that could shed all the U.S. jobs added by employers in the past decade and push the unemployment rate to record highs. So that's about the economic situation. The cases of COVID-19 pandemic are increasing by the day. The countries severely hit by this pandemic are Italy, US, Iran, France and Germany. Here's how they are impacted by COVID-19. A wrap of global developments related to COVID-19. Spain's coronavirus death toll has crossed 10,000. A total of 932 people died from the disease in 24 hours, down from 950 people in the previous daily toll. The Health Ministry said that the number of registered cases rose to 1,17,710 on Friday, up from 1,10,238 on Thursday.
It's absolutely critical for the American people to follow the guidelines for the next 30 years.
U.S. President Donald Trump said that he underwent a second coronavirus test using a rapid diagnostic that produced a result in less than 15 minutes, and it determined that he has not been infected. Trump announced his test results during a White House briefing. Trump announced plans for the U.S. military and federal personnel to operate a makeshift hospital set up in the Javits Convention Center in New York to help the city grapple with a flood of patients in his daily White House briefing. New York has become the epicenter of the U.S. epidemic with more than 47,000 confirmed cases in the city. NATO members agreed on Thursday to speed up deliveries of medical aid to allies suffering the most from coronavirus by assessing its airlift capacity and by matching its members' capacity and need for such equipment. Speaking after a video conference with military alliances foreign ministers, Secretary General Jens Stoltenberg said that NATO had already provided logistical support to its members over the past few days through its support and procurement agency, its strategic airlift international solution and strategic airlift capability mechanisms. The comments come as NATO is scaling down military exercises in Europe to curb the spread of coronavirus. And with that, we come to the end of this edition of Tracking COVID. Remember to keep washing your hands or use sanitizers. Stay safe, stay healthy, stay happy.
इनमें से एक है आपका डिटर्जेंट और एक फेना। अब आप बताइए कौन सा बेहतर है? ये है ज्यादा सफेद फेना।
ब्लाइंड वॉशिंग टेस्ट में 100 में से 70 लोगों ने फेना सुपर वॉश को अपने डिटर्जेंट से बेहतर पाया है।
अब आप भी लीजिए फेना सफेदी चैलेंज और खुद कहना फेना ही लेना।
हर घर की एक कहानी होती है और कहानी में कहीं ना कहीं एक घर होता है। ये होती है आपकी, आपके रिश्तों की और आपके परिवार की। ये आपकी कहानियों का घर है। अपने रिश्तों को और सुंदर बनने का मौका दें। आपके और आपके परिवार की खुशहाली के लिए LIC हाउसिंग फाइनेंस दरख्वास्त करता है। घर में रहिए, सुरक्षित रहिए।
125 करोड़ से ज्यादा आबादी का देश, तो लगभग इतनी ही जेबें भी होंगी, पर एक VIP नंबर है जो लगभग हर एक जेब में पाया जाता है। उसे दिखाओ तो बैंक में खाते खुल जाते हैं आसानी से। अपने हक के पैसे सीधे खातों में आ जाते हैं आसानी से। बैंक हमारे दरवाजे तक पहुंच जाता है। इनकम टैक्स वेरिफिकेशन भी हो जाता है आसानी से। इसीलिए कहते हैं भैया
आधार अपना लो,
फायदे में रहोगे।
पहला अक्षर अरट लो तो वह से एक विद्वान होगा। पक्की होगी बुनियादें तो हाँ से हिंदुस्तान होगा। पहले करो शुरुआत करो तो पक्की बात करो।
वंडर सीमेंट, एक परफेक्ट शुरुआत।
Hey girls! Hi! Congratulations! आज तो पार्टी चाहिए। पहले चैंपियन के साथ सेल्फी लेंगे।
आइडिया, यही करते हैं पार्टी।
पिज्जा पार्टी। ये चल अपना कार्ड और पिन दे।
मेरे कार्ड की डिटेल्स मैं खुद ही डालूंगी। RBI कहता है अपना पिन, OTP, CVV या इंटरनेट बैंकिंग पासवर्ड किसी के साथ शेयर ना करें। ऑनलाइन बैंकिंग सिर्फ अपने कंप्यूटर, मोबाइल और सिक्योर नेटवर्क से करें।
बाय गर्ल्स, कहाँ जा रही है? सुना नहीं? नो शेयरिंग।
RBI कहता है जानकार बनिए, सतर्क रहिए।
मैडम, उमंग सर बुला रहे हैं।
उमंग सर की सुबह में कुछ ज्यादा ही उमंग आ गया है।
क्या जोक चल रहा है?
कुछ नहीं, बॉस ने क्या कहा?
इतना बड़ा प्रोजेक्ट दे दिया है।
तुम तो फेल नहीं हो सकती।
ऐसी अपनी मुस्कुराहट दिखा देना, बहुत आगे जाओगी।
एकदम सही कहा नितिन, बहुत आगे जाएगी अंकिता।